Hello everyone, welcome to my channel Capsa. So today's topic is about radioimmunoassay. Radio means obviously there will be use of radioactive material or radioactive isotopes, and immune means there will be immunological reaction or antigen-antibody reaction, and assay is the estimation procedure. So that is radioimmunoassay. Okay. So this technique was developed by Solomon Berson and Rosalyn Yalow. Solomon Berson was a doctor and Rosalyn Yalow was a nuclear physicist. Okay, they developed this technique in 1959 for the measurement or estimation of insulin in human serum. Okay, if the compound is present in low concentration in the biological samples, like in nanogram or picogram, then this technique is suitable or good for that purpose. It's a kind of competitive assay technique. Why competitive? Because there will be a competition between labeled and unlabeled antigen to bind with the antibody to form the antigen-antibody complex. That's why it's a competitive assay technique. This technique used for the measurement of antigen concentration in samples. Which kind of antigen? For measuring the plasma levels of most of our hormones, some drugs like digitoxin, digoxin, certain abusive drugs like cocaine, opiates, etc. In case of some infectious disease like HIV, some autoimmune disease like SLE or systemic lupus erythematosus. And sometimes measuring toxins in contaminated foods. So these are the application or use of RIA. Okay. Now which kind of radioactive isotopes are used? That are I-125, I-131, C14, H3. These kind of radioactive isotopes are used. You need to keep in mind that these two are gamma radiating isotopes. Okay, but these two are beta radiating isotopes. Clear? Now for that reaction, three kinds of material we need. First one is radioactive antigen or labeled antigen, sometimes known as hot antigen. Antibody specific for that antigen, and unlabeled known concentration antigen or the sample, which is known as cold antigen. Okay, and when there is a antigen antibody reaction, that will look like this. This is labeled antigen. When bind with antibody form this kind of complex. After addition the sample, when we increase the amount of sample concentration, there will be a replacement of labeled antigen. There will be a complex formation of antigen antibody. Okay, so this kind of reaction will take place. Now we will understand the RIA procedure step by step. So first, by using serial dilution method, prepare the sample or the antigen or cold antigen. Okay, then prepare the antibody. How the antibody will be prepared? Obviously by injecting the antigen to the goat or sheep, the antibody will be prepared. After that, fix the known concentration of antibody or quantitative concentration of antibody in a microtitration well or microtiter well. Okay, then prepare the known amount of labeled antigen. How the labeled antigen will be prepared? Whenever we react with antigen and the radioactive isotope, the radioactive iodine have the ability to react with the tyrosine residue of that protein or antigen. Okay, that's how the radioactive or labeled antigen is prepared. Then add that labeled antigen to the wells. Okay. After binding this kind of antigen, labeled antigen, with that antibody, they will form a complex. Okay. This kind of antigen antibody complex will be formed, and there will be obviously some excess amount of unlabeled or unbound labeled antigen. If there is, suppose, 3 antibodies present, obviously there will be binding of 3 label antigen, and the excess antigen will be present in the well. So we need to wash to remove that unbound label antigen. So it is washed to remove the unbound label antigen. Obviously wash it by using not water, by using wash buffer. Which kind of wash buffer is used? The composition is 1% trifluoroacetic acid is used for wash buffer to remove the unbound labeled antigen. After that, add the sample or unlabeled antigen or cold antigen. Okay, when there will be addition of the cold antigen, obviously the cold antigen or unlabeled antigen will compete with the labeled antigen for binding to that antibody. So obviously there will be free unlabeled antigen which are displaced. After that, wash to remove by using buffer to remove the labeled antigen which are displaced by the unlabeled antigen. Okay. So then measure the radioactivity by gamma counter. Now that is the point how this kind of measurement will be occurred. So radioactivity is calibrated with the standard curve by plotting the radioactivity with the unlabeled antigen concentration to determine the concentration of antigen. Now we need to understand that when there will be a displacement of that unlabeled labeled antigen, there is a complex of label antigen and antibody. This kind of complex previously formed. When we add the unlabeled antigen and increase the concentration, obviously there will be displacement of that labeled antigen and there will be a complex of antigen antibody. So displacement means when the increase of antigen antibody unlabeled antigen antibody complex increases the concentration, obviously radioactivity decreases. Because addition of unlabeled antigen, more unlabeled antigen will displace the label antigen. So if the displacement of label antigen will occur, obviously there will be the decrease in the radioactivity that is used by measuring the concentration curve. Okay, so this radioactivity is plotted against y-axis, and this is the unlabeled antigen concentration. When there is increase in the unlabeled concentration, antigen concentration, the radioactivity will be decreased due to the displacement of labeled antigen. Clear to you? So this is the end of my lecture. If you like my video, please do like, comment, subscribe to support me. Okay? Thank you.